Thank you, everyone. Thank you, Sanjeevani, for giving me the platform. Today, 4th Feb, World Cancer Day, we are celebrating the theme Close the Care Gap. And my topic of discussion is gap during the diagnosis of the cancer. So, on the very initial stage, when a patient is suspecting a cancer or just being diagnosed with cancer, we faces three challenges basically. First is fear of the disease or denial. Secondly, difficult to understand the treatment process, the diagnostic dilemmas, and thirdly, how to overcome the lengthy, complicated treatment process and the rehabilitation process. So, when we initially breaking the bad news to the patient, we need to be very elaborate, sensitive, and do it in a very positive note so that that patient and his or her relatives can understand that what is the disease, what is its nature, prognosis, how we can properly diagnose and stage it and treat it, and what is their life expectancy. So it requires a lots of time, and there it's a gap, create a gap between the doctors and the patient, because sometimes we don't give such time in our government setup where we have a huge number of patients. So there is some gap, create a gap in our between our patient and doctor, so they sometimes feel neglected. So here we have our social worker, thanks to Sanjeevani, they help us to close the gap. They with from our knowledge, they impart to the knowledge to the patient in their own language and help to understand the knowledge and educate them about the treatment process, how they can lead a healthy life during the treatment, and how can after that the rehabilitation process. So cancer diagnosis needs a long battery of tests. It's starting from a basic blood test to the costly radiological tests, CT, MRI, PET CT, and then biopsy and immunohistochemistry to the molecular test to genetic profiling. All is necessary to stage the disease, then prognosticate the disease, and ultimately done a multidisciplinary approach to the treatment. So this is again a create a gap between the patient and the doctors, because after a basic diagnosis of the treatment with a cancer with a FNAC or radiologically, patients are very much concerned why my treatment is not initiated, where doctors are doing lots of tests, costly tests, painful biopsy, waiting for the biopsy report, ISC report, why they are asking for genetic profiling. So this gap we need to be covered up, because this create a very mistrust to the patient relatives, and goes to different cities, different hospital, different doctors to get or opinions. So this created delay in initiation of their proper treatment, and this gap need to be covered up, because from initial symptoms to first treatment, there is most of the patient undergone a gap of 6 months to 1 year, which create adverse result from their treatment result. Next slide, please. Next slide, please. So this is the battery of tests we need to diagnose the cancer. We need to discuss to the relatives that we should have to do this, all this of this, depending of your cancer side, to ultimately confirm the diagnosis, stage it, prognosticate it, and ultimately do the treatment outline. So if patient and relative does not understand this, so there will create a gap between the doctors and the patient, and patient will ultimately default either during diagnosis or even during the treatment, even they don't come for the follow-up also. So our basic aim for close this gap is first is cancer awareness about the symptoms of the cancer. So whenever they develop this type of symptoms, they goes to the they goes to the doctors and clinics so that early detection is possible. And even after early detection they should undergo the required test and for the staging and prognosticate purpose, and initiate the treatment as early as possible. Next slide, please. Next slide. Next slide, please. Sorry, I think there is some problem. So with these 3 steps, we can avoid this delay, and we help them to patient to detect early, treat in proper way, and lead them to a curable life, better quality of life. And in my institute, Sanjeevani done a very great job there. Members always by the patient helps them to understand this process and go through the treatment process. So thank you, Sanjeevani, very much. Thank you very much.